Committee will come to order. I'd like to begin this hearing by stating the Oversight Committee mission statement. We exist to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is the mission of the Oversight and Government Reform Committee. I'd like to also start off by issuing condolences and concern for the situation in Libya. Our ambassador was killed, others were killed, men and women who served this country. The gentlemen that are here before us on this panel, we cannot thank you enough for your service. You have distinguished, well-deserved accomplishments serving your country and this nation at great sacrifice to you and your families. We cannot thank you and the literally millions of people who have gone before you and served this nation, people who at this very day are overseas and here at home serving their nation. It is heartfelt. It is bipartisan. It is the American way, and certainly at this time when we have a tumultuous situation in various parts of the world, most recently the loss of life there in Libya, our hearts goes out to those that are serving, and also the families, the husbands, the wives, the kids who maybe are back home and worried about their loved ones that are overseas. Today we're talking about a very difficult situation, something that I think went awry. What separates the United States of America from probably the rest of the world is our openness and transparency, the fact that a Congress can sit down with two distinguished generals and talk candidly about what happened or didn't happen in a format that allows these discussions, although difficult. It's what separates the United States of America, I think, from everybody else. So I do appreciate you being here, and I'd like to get into my more formal statement. Today's hearing is Dawood National Military Hospital, Afghanistan. What happened and what went wrong? And this is the second part, having had a hearing a couple months ago on this topic. I'd like to welcome Ranking Member Tierney, members of our subcommittee, and members of the audience who are participating with us, and those who are obviously watching via television or on the Internet. Today's hearing continues the subcommittee's investigation into the rampant corruption, physical abuse, and lack of accountability at the Dawood National Military Hospital in Afghanistan. The National Military Hospital was established for the purpose of treating wounded Afghan soldiers. It is funded largely by the United States and is known as the crown jewel of the Afghan medical system. The hospital is staffed by Afghan doctors and nurses who are mentored by U.S. military doctors. While the U.S. military personnel advised the Afghan medical staff, they did not administer treatment or pharmaceuticals. That was the responsibility of the Afghans. Their mission is to, quote, help the Afghans perform and increase their capability, not by doing for them, but by rather advising them and stepping back, end quote. They perform, quote, not as a clinician, not as a nurse, not as a technician, but as a trainer. When they come here, it is advising, end quote. During the summer of 2010, and as early as 2006, allegations began to surface regarding widespread theft, mismanagement, and patient neglect at the hospital. Evidence indicates that wounded Afghan soldiers endured starvation, bed sores, and gangrene. Some patients were extorted for medical care, while others were abused, neglected, and made to suffer. Afghan doctors operated in smoke-filled rooms without anesthesia or painkillers. Maggots crawled from festering wounds. Some patients died from lack of care. If not for family members who bribed officials for medicine, many more probably would have perished. According to firsthand accounts, Afghans stole fuel needed to run generators and sold pharmaceuticals on the black market. Afghan doctors and nurses would rarely show up for work after being trained at considerable United States expense. Documents indicate that misappropriation of resources were staggering. Medical supplies and equipment were hoarded, stolen, and misused. In 2010, Afghan Surgeon General Yaftali was suspected of pilfering $20 million in cash and $153 million worth of medical supplies over a 5-year period. It is also reported that supplies were shipped to Pakistan while legitimate pharmaceuticals were replaced with counterfeits. Yet the United States government continued to ship supplies without accountability controls in place. These accounts were corroborated by senior U.S. military officials at our July hearing. One panel member described the conditions as Auschwitz-like. Another testified about an abusive, corrosive environment with no heat, open vats of blood draining from wounds, and feces on the floor. In addition to poor standards, the hospital was infested with a criminal patronage networks. Now, what I'm about to show you is extremely graphic. These are but 4 of the 70 pictures we obtained through this investigation. If there are children watching, I would encourage them to look away and ask them to leave the room. If you're at all squeamish, consider turning around and stepping out. These are exceptionally graphic. I would encourage you not to look at them if you have any hesitation. There are a lot of U.S. personnel who suffered psychologically from what they saw on a frequent basis. We know of many of U.S. personnel who are still seeking psychological counseling for what they had to witness and experience there at that hospital. These are awful conditions, and they were financed in part by the United States taxpayer. From July to November 2010, senior U.S. military officials reported these issues up their chain of command. This includes briefings to General Petraeus, Lieutenant General William Caldwell, and Major General Patton. For example, on August 25, 2010, Lieutenant General Caldwell received an exhaustive email about the problems at Dawood and lack of accountability. Despite all the evidence, there appeared to be a hesitation to investigate further. In fact, witnesses testified that there may have been a deliberate effort to delay an investigation for political reasons. This was followed by an apparent attempt to prevent information from reaching Congress and the American people. Problems with transparency and accountability are unfortunately not unique necessarily to the Dawood Hospital. The Inspector General for Afghanistan Reconstruction issued an alert letter on Monday indicating that hundreds of millions of dollars worth of fuel supply records may have been shredded by personnel in Afghanistan. This occurred despite a Department directive to preserve financial information for the purpose of transparency. We will explore this in a hearing tomorrow with the Special Inspector General for Afghan Reconstruction. But there are other challenges that we have here that we need to discuss in a broader sense with the Pentagon. In an email on January 1, 2011, Colonel Marion Amrine, I hope I'm pronouncing that name properly, sent an email to Colonels Carrozza and Anderson regarding a tasker to send information to the IG on Afghan General Yaftali's suspected pilfering at Dawood Hospital supplies. In that email, Colonel Amrine stated, quote, Brigadier General Patton reviewed the summary and documentary evidence that we intend to provide. He made changes and told us to reduce the documentary evidence that we provide, end quote. Regarding the photo policy, on September 12, 2011, 9 days after the Wall Street Journal broke a story on Dawood Hospital, the command surgeon disseminated a memorandum with a new policy forbidding personnel from taking pictures of the hospital and patients and disseminating it to others, instructing those photos to be shredded and dismissed. Withholding General Geller's memorandum for the record, myself and Chairman Issa sent a letter to the Department of Defense on October 13, 2011. Colonel Geller was tasked with creating a timeline and description of events, which resulted in a 25-page memorandum for the record. Instead of providing that document to the committee, the Department of Defense created a separate chart that contained only selected information pulled from the original memorandum, thus withholding full information from the United States Congress. Further, Colonel Geller was prevented from speaking to the media. And then we have this report from the SIGAR, the Special Inspector General for Afghan Reconstruction, about years of financial records recording U.S. fuel supplies and products of Afghanistan either missing or may have been destroyed by Department of Defense personnel in the Combined Security Transportation Command Afghanistan. And then we have the situation regarding the Palantir system. Inexplicably, the Department of Defense destroyed or replaced an independent assessment of an intelligence analyst tool, Palantir, used and preferred by soldiers in the field. The revised report diminishes the survey comments made by the soldiers in the field to reduce the perceived preference for the Palantir system. There are concerns that documents have been shredded there, with an email that indicates that that did happen. This should not be. If these reports are accurate, then we are witnessing a pattern wherein transparency and accountability are exception and not the rule. This is totally unacceptable to the American way. I am encouraged by more recent reports of progress at Dawood Hospital and the Afghan medical system. Our men and women in uniform have an exceptionally difficult task and should be commended for their efforts. But we have to be better stewards of taxpayer dollars. I urge President Obama and his administration to reconsider and reprioritize our strategy and what we seek to accomplish. But let me be clear. Given the large sums of money Giving large sums of money directly to the Afghan government is no substitute. It is not a legitimate withdrawal strategy. We have to make sure that all money is accounted for and that any person misusing money is held accountable. Should the taxpayers continue to fund a foreign government that has a history of misusing that funding? The concern is that the American policy is gravitating not to more oversight, but less oversight. The government seems to be moving in a trajectory to want to give the money directly to the Afghans, and yet time after time after time we see a pattern of misuse, abuse, and just outright fraud. And that's the concern as we try to bring our troops home. I look forward to hearing from the panel and appreciate everybody's willingness to be here. I now recognize the distinguished ranking member, the gentleman from Massachusetts, Mr. Tierney, for his opening statement.
Thank you very much, Mr. Chairman, and thank you, Generals and Ambassador, for joining us here this morning. This subcommittee has a history of being concerned with the issues of corruption and mismanagement of the United States taxpayers' dollars in Afghanistan. In 2005, I co-authored bipartisan legislation with then-Congressman Jim Leach that led the way to the creation of the Commission on Wartime Contracting. And that commission issued a report last fall estimating up to $60 billion in waste, fraud, and abuse of United States taxpayer funds in Iraq and Afghanistan. Under our chairmanship, this subcommittee conducted multiple investigations into allegations of corruption in United States contracting relating to the war in Afghanistan. In partnership with the minority, we investigated jet fuel contracts in Kyrgyzstan and the host nation trucking contract in Afghanistan. While our investigation of the trucking contract found that contractors were making protection payments to our enemies with U.S. taxpayer dollars. So I support Chairman Chaffetz's continuing investigation, including today's focus on Dawood National Military Hospital in Afghanistan. In July, this subcommittee held a hearing in which 4 current and former military officers recounted their firsthand observations of the mismanagement and corruption at the hospital. The conditions these witnesses described were truly appalling. No hot water for hygiene, no cleaning supplies for sanitation, even a lack of heat during the winter. Due to contracting fraud, the morphine given to patients was counterfeit and did little to relieve patient suffering. Corruption permeated the highest levels of hospital leadership in the Afghan Army's medical logistics system. In response to these revelations, I called for an expansion of the subcommittee's investigation. I believe we have to change our spend first, ask questions later approach to reconstruction in Afghanistan, where the United States has already committed nearly $100 million to reconstruction efforts. $100 billion, I should say. To that end, I welcome today's hearing to further our examination of what happened at Dawood Hospital. We must all recognize, however, that the problems at the hospital and within the Afghan Army's medical logistics system are longstanding. In fact, the United States support for Dawood Hospital began around 2005, 5 years before senior military officers began raising concerns and ultimately recognizing the need for outside assistance, and 4 years before Lieutenant General Caldwell assumed command of the NATO training mission. With the former commander and his deputy here before us today, I want to know how the conditions deteriorated to this shameful point, how our mission could progress for so long without more attention to these important issues, including from the DoD Inspector General, and what steps General Caldwell and General Patton took to confront these challenges. Going forward, I also want to know how our current training and equipping mission can be improved to ensure Afghan participation accountability. In the course of this investigation, the Chairman has raised concerns that Lieutenant General Caldwell and Major General Patton inappropriately interfered with the Defense Department's Inspector General's oversight at Dawood Hospital. I share those concerns, and the Chairman has gone further, however, and suggested that their motivation was political, to influence the 2010 congressional elections. At our last hearing, several witnesses testified that an objectionable comment was made. However, some of the witnesses also stated that the comment was dismissed as inappropriate for consideration. I look forward to learning more about what happened and to hear directly from the generals what their motivations were. Additionally, it is my understanding that due to the utmost professionalism of the Department of Defense Inspector General, The alleged attempts at interference did not impair the Inspector General's ability to timely perform its critical work in Afghanistan. Indeed, the witnesses at our last hearing on Dawood Hospital testified that the Inspector General's work directly led to significant improvements in the conditions at Dawood Hospital. Nonetheless, any interference with the Inspector General's important oversight would be unacceptable. The Inspector General is currently investigating this particular allegation. I look forward to reviewing the report when it is completed. So I want to thank all of you, and I look forward to this hearing and the testimony that we'll hear. Thank you.
I thank the gentleman. The other gentleman from Massachusetts care to issue a statement?
I would. Thank you very much, Mr. Chairman. First of all, I want to thank the witnesses for their attendance here and for your service. I appreciate that greatly. Mr. Chairman, our involvement in Afghanistan has been one of the largest and most complex undertakings our country has ever undertaken. Not only are we fighting al-Qaeda and the Taliban, but we're also trying to help rebuild a country that was severely undeveloped and ravaged by war even before 2001. Our efforts to rebuild or, in many cases, build in Afghanistan have turned out to be as great a challenge in the face of the corruption that exists there in country as the military mission. The egregious case of the Dawood National Military Hospital highlights how mismanagement and corruption have been and continue to be among the biggest obstacles to NATO and Afghan efforts to rebuild and develop Afghanistan. It's my hope that this hearing and this committee's investigation will unearth ways to help support the fundamental changes needed to keep this from happening again. Again, I do appreciate the attendance and the service of our witnesses this morning, and I'm looking forward to clarifying some of the issues that arose at the first round of hearings that we had on this issue. Mr. Chairman, thank you for the time, and I yield back.
Thank you. Members may have 7 days to submit opening statements for the record, and will now recognize our panel. Lieutenant General William Caldwell is the Commander, United States Army North 5th Army, and Senior Commander, Fort Sam Houston and Camp Bullis. Major General Gary Patton is the Director of Defense Department's Sexual Assault Prevention and Response Office, and Ambassador Kenneth Moorfield is the Deputy Defense Inspector General for Special Plans and Operations. Obviously, some of these assignments and titles at the current moment have changed since their assignments for General Patton and General Caldwell have served in Afghanistan. Pursuant to committee rules, all witnesses will be sworn before they testify. Please rise and raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Thank you. You may be seated. Let the record reflect that the witnesses answered in the affirmative. In order to allow time for discussion, we would appreciate if you'd limit your testimony to 5 minutes, but we're going to be pretty liberal on that time. If you choose to take longer, we'd be more than happy to hear what you have to say. But we'll start now by recognizing General Caldwell.
Thank you, Mr. Chairman. Good morning. And Ranking Member Teneray and other committee members, thank you for this opportunity to appear today.
Thank you. Oh. Just a little bit closer, if you could. Thank you.
It's directional.
Thank you.
Thank you. All right. Excuse me. I have submitted my full statement to the committee, which I would ask to become a part of the record. Let me begin by saying it is a true honor to serve our nation now for over 36 years, both in peace and in conflict. Being here today is vitally important to me because the sacrifice and selfless service of America's sons and daughters and their Afghan counterparts deserve nothing than the truth to be known. On November 21st of 2009, the NATO Training Mission Afghanistan, or is called NTMA, was established to coordinate and synchronize the multinational efforts to raise, equip, train, and sustain an Afghan national security force. I assumed duties as the first NTMA commander and also assumed duties as the commander of the United States Combined Security Transition Command Afghanistan, which is the authority responsible for the oversight of U.S. funding, training, and ministerial development. The span of my command included nearly 7,500 military, civilian, and contract trainers, advisors, instructors, and support personnel, and 6 regional support commands, and 70 training sites located in 21 of the 34 provinces inside of Afghanistan. The scope of our combined command's mission was unprecedented. This was a unique challenge as we had three simultaneous tasks. First, we had to establish a new multinational command. Second, we had to train, generate, and sustain an enduring Afghan national security force that included the Afghan Army, police, and Air Force, and all of their associated support systems. And third, we had to develop, advise, and mentor at all levels of the Ministry of Defense and the Ministry of Interior. These challenges were complicated by existing factors that required immediate attention, such as an 86% illiteracy rate. This required us literally to teach writing and reading to all the basic recruits and to many officers. A prior focus that was on quantity over quality in recruiting and training, which resulted in the need for retraining and a reorientation on quality. Minimal oversight and accountability of material and equipment. This required a top-to-bottom review of inventory processes and the inculcation of an ethos of stewardship within the Afghan security force. And finally, endemic corruption, which frustrated every effort and mandated leadership changes and implementation of ethical standards. In order to focus the effort of our organization from the first day of command, I approached the challenge by enacting what we named the 3 T's. The first was teaming. Teaming in order to enable the Afghans to transition to security lead when the U.S. and NATO reduced their presence. We knew it was imperative that the Afghans start owning their challenges and attempt to solve these things on their own. Therefore, we needed to team closely with the Afghan ministries and their security forces. My command embraced this in everything we did. This philosophy was also held by each of the 3 ISAF commanders I served under. One of them, General Petraeus, in his July 4, 2010 letter to ISAF troops reinforced this point when he said, I quote, "This endeavor has to be a team effort. We must strive to contribute to the team of teams that work in Afghanistan to achieve unity of effort." End of quote. The second tenet was transparency. I held a firm belief that NTMA must be transparent in all that we did. No area was off limits to any outside entity. Additionally, in early August of 2010, the Department of Defense IG embedded into our organization a member of their team. They had complete access to all of our individuals, our files, and our meetings. We were 100% transparent with them. And the third tenet was transition. NTMA's end state was to enable the security responsibility to be passed to the Afghan ministries and their security forces. Therefore, we could achieve transition only by effectively teaming with the Afghans. It was with these 3 tenets of team, transparency, and transition that I made the majority of my command decisions. I reinforced this continuously with our NTMA staff, trainers, instructors, and advisors during my tenure there. We're here today to talk about the Afghan military medical system. Afghanistan is a sovereign nation where their medical care was ranked in the bottom 10% globally by the World Health Organization. This poor medical care presented issues that were complex and required a high degree of coordination with our Afghan partners, coordination that was necessary and critical in order to have any chance of this care being established and enduring beyond our presence there. In conclusion, I supported all investigations, audits, and assessments into any aspect of our command. At one time during my tenure, we had in excess of 27 simultaneous audits or assessments by multiple government agencies external to our command ongoing. We embraced these so that we could remain transparent as possible and to demonstrate sound stewardship of the resources that had been entrusted to us by the American people and the U.S. Congress. At all times, the command team and I addressed issues aggressively and immediately as they were presented to us. I welcome a discussion and your questions about the challenges we faced and how we addressed them. Thank you.
Thank you, General. General Patton.
Chairman Chaffetz, Ranking Member Tierney, and the members of the subcommittee, thank you for inviting me and providing me with the opportunity to testify about my role with respect to the National Military Hospital during my deployment to Afghanistan with NATO Training Mission Afghanistan, NTMA, from December 2009 to May 2011. I would like to begin by first stating that it was my honor and privilege to serve our nation in Afghanistan for those 18 months. just as it has been an honor and privilege for each and every day of the past 33 years of my military service, which includes 45 months in combat and tours of duty overseas in Iraq, Afghanistan, and Korea. For the first 6 months of my assignment at NTMA, from December 2009 to May 2010, I served as NTMA's Deputy Commander for Programs, and in that job was responsible for the oversight of the Afghan Security Force funds for the training and equipping of the Afghan National Army and Afghan National Police. For the subsequent 12 months, from May 2010 to May 2011, I served as the NTMA Deputy Commander for Army and was responsible for overseeing the development of the Afghan National Army and advising the Afghan Ministry of Defense. The scope of this mission demanded oversight across several major systems and sets of infrastructure, such as the National Training System and the National Headquarters. This mission occurred at a time during Operation Enduring Freedom when the success of the NTMA mission in manning, training, and equipping a professional and capable Afghan National Army, Police Force, and Air Force was essential to the coalition's success. It was a challenging period of time in Afghanistan, marked by a persistent enemy and countered by an Afghan security force that was undergoing unprecedented growth in terms of quantity, quality, and capability, yet still plagued by leader shortages and high levels of attrition and illiteracy. NTMA's objective was to build and develop an Afghan security force capable of enduring with reduced or minimal NATO or U.S. support in 2014 and beyond. I have been invited here today to address the management of and medical care provided by the Dawood National Military Hospital, NMH, in Kabul. The problems associated with the NMH were highly complex ones, complicated by elements of Afghan corruption, failed Afghan leadership, and hospital staff apathy, worsened by the inherent problems of national illiteracy and the historic inadequacy of Afghan health care, and finally, burdened by the consistent flow of wartime casualties. NTMA devoted considerable time and energy to improving the medical care and management of the hospital, along with accomplishing our other continuing significant tasks of manning, building, training, developing, and equipping the Afghan National Army while at war. We took very seriously our role as advisors to drive positive change at the hospital through active, persistent, and firm engagement with our Afghan partners. It was important from the outset that this be a partnered effort, because in our experiences working with other Afghan systems, although a coalition solution to a problem would usually yield an immediate fix, only a partnered or Afghan-led solution would produce an enduring result. In closing, I would like to say that I am proud of the accomplishments of NTMA and the service members of NTMA with whom I served during my deployment to Afghanistan. I appreciate the opportunity to be here today, and I look forward to your questions. Thank you.
Thank you, General. Ambassador Moorfield.
Chairman Chavez, Ranking Member Tierney, and distinguished members of the Subcommittee on National Security, Homeland Defense, and Foreign Operations, good morning. Thank you for this opportunity to discuss past and present DoD-IG oversight of the Department's efforts to develop the Afghan National Security Forces healthcare system, in particular that at the Dawood National Military Hospital. Meeting this challenge has understandably proven difficult, made even more so because the country has been involved in an intense war. When the ANSF medical care system development efforts began, the country's public health care was considered by international experts as among the worst in the world. Given the importance of this mission to our success in Afghanistan, DoD-IG has undertaken 7 oversight initiatives since April 2008. I would like to highlight several of these, but my written statement, for the record, discusses results from each. In late October 2010, the then Systica Inspector General, on behalf of the Command, requested DoD-IG assistance in addressing, quote, possible discrepancies concerning the distribution of and accounting for pharmaceuticals distributed to the ANA, end quote. On November 10, 2010, the NTM Alpha Systica Commander, General Caldwell, sent me a message reconfirming his command's request for DoD-IG medical logistics mission assessment, adding that with the assistance of a recent increase in personnel, he had become increasingly concerned about, quote, possible illicit activities and inadequate accountability measures concerning pharmaceuticals supplied. My team deployed to Afghanistan on November 28, 2010. After visiting the NMH, 3 of 4 regional hospitals plus associated medical depots, we outbriefed the command with identified deficiencies related to dysfunctional medical logistics, which also negatively impacted ANA hospital management and patient care at ANA hospitals, a lack of strategic planning to better focus NTM-alpha Cystica and ANA joint efforts and make effective use of scarce resources, and finally, hospital mentoring teams staffed at only 50% of authorized personnel, among other issues discussed. In February 2011, as a result of the November assessment mission, we held an inspection of just the NMH focused on unacceptable conditions reported by the command concerning hospital management, medical personnel conduct, sanitation and patient care, and supply and inventory issues. This also resulted from a joint Cystica IG and MOD IG series of inspections of the National Military Hospital. Although the state of general sanitation and medical supplies had improved, a number of the other concerns were confirmed, and we made recommendations to the command for corrective actions. In June of this year, the DoD IG again assessed the National Military Hospital and the ANSF medical care system in a number of key areas necessary to create an independent, sustainable system. We found that development had advanced in the areas of planning and mentoring, leadership and management, and logistics and patient care, specifically with respect to establishment of a strategic plan to develop the ANSF healthcare system, strengthen personnel accountability and patient care procedures at NMH, inventory accountability and control measures instituted for medical supplies at NMH, improved patient care and nutrition at NMH, and an evident commitment by the new ANA Surgeon General and NMH hospital commander to continue work on improving whatever needed to be improved at the hospital. Lastly, I should mention, although this wasn't initially something I was going to raise, but since the issue of fuels came up, controls had been imposed on the fuel supply system to the hospital. Significant challenges still remain with respect to the development of the ANSF medical system and the NMH capacity building initiative. Reportedly, as U.S. and coalition forces draw down over the next several years, the decreasing numbers of medical mentors will focus on priority medical areas requiring improvement. At NMH, these areas include emergency room, anesthesia, physical therapy, preventative medicine, and radiology. And improving medical logistics support for the ANSF and its medical care system is critical and is expected to require attention through 2014 and perhaps beyond. Finally, I should add that reinforcing ANSF commitment to the enduring stewardship of its healthcare system will need to remain a priority of both the command and the Afghan government. In closing, let me emphasize that DoD IG is committed to continued oversight of the development of ANSF healthcare, including at the National Military Hospital. I look forward to answering any questions that you may have, and thank you.
Thank you. I appreciate that. If any have additional, your full statements will be entered into the record. And I'll now recognize myself for 5 minutes. General Caldwell, I read your prepared statement last night. Quite frankly, I was a little surprised. There's some very serious allegations about Dawood Hospital. The title of this hearing is about Dawood Hospital. It doesn't even mention Dawood Hospital in your statement. You've undoubtedly read the Wall Street Journal article that made this much more public. What happened? What's your response? Your spokesperson said you were eager to refute this. You had disputed it, and you were looking forward to an opportunity. So I'm giving you an opportunity to respond. What happened at Dawood, and what went wrong?
Well, thank you, Chairman, for that question. What I was attempting to do in my statement is provide you an overview of the approach we took so you understood the mentality upon which we were trying to operate during the 2 years I was the commander there. I think if you don't fully appreciate that everything we did, we had a team with the Afghans on because we eventually had to set the conditions for transition. In 2014, it was absolutely essential. Our President had been very clear that we were going to significantly reduce the United States and NATO presence there. And in order to make sure the Afghans were prepared and able to account for, maintain, sustain what we had spent years and years of Americans' lives and money doing, we wanted to make sure, I wanted to make sure that everybody in that command understood, team with your Afghans, do it in a transparent manner. I wrote in December of 2009 to General McChrystal when I first came in after a 30-day assessment that there was rampant corruption throughout the entire Afghan system that I could see in my initial 30 days there. And therefore, the more we could get them to be transparent in everything they were doing, to make their systems more open, to hold them more accountable for their actions, that in fact would ensure the stewardship that was necessary of the resources that we were being given by the American people through the U.S. Congress.
But General, you also understood that you didn't have the internal resources to provide the oversight. I mean, that's clear through a series of emails to you, from you. I think you understood that you didn't have the internal controls in place. We knew that Surgeon General Yaftali was under an investigation for stealing $20 million and another $150 million in pharmaceuticals. And you have colonels and others that you had tasked to oversee this at Dawood Hospital, and this keeps going for months and months with no request for additional help and support from the Inspector General. That's the concern, is why the delay in asking for additional resources through the Inspector General to help with the corruption and challenges at Dawood? What happened at Dawood? Because we would all probably agree that this is almost an impossible task in Afghanistan. Right. And we cannot thank you enough for your service in that. But specific to Dawood, what happened?
Chairman, the first thing we did was in the May time period of 2010, when we finally got some additional resources that I had requested back in December of 2009, I was able to put some people into the hospital system that we had not previously had. And it was during that time, a young major that went in there, that she was starting to help us understand the pharmaceuticals and the challenges that were associated with that. By that summer, it was becoming apparent to us that there was corruption in the system, and we were then trying to establish whether, is it just going into warehouses? Is it corruption where people are making a profit off it? And so we internally started looking at very hard at the whole corruption issue. You made reference to the August 25th email that Colonel Carrozza wrote to me and shared with me, again, because we were all in an active discussion and trying to sort through where this corruption was occurring and how it was occurring, and said, this is what we're seeing right now. I immediately wrote back to him and said, we take very seriously what you're saying. We've got to get the team together. I'd ask you to work with the Army team as we continue to move forward on this. A month later, I write to General Petraeus on the September 25th in the emails we provided to the committee, and I explained to General Petraeus that we have a massive corruption problem in the pharmaceutical system inside of Afghanistan, and that we think it's going to eventually rise to the point where it's going to require the removal of a general officer, which therefore would mean we're going to need to invoke and use the President of Afghanistan to assist us, since as in our own system, nobody in the military has the authority to remove a general officer. It takes in Afghanistan the President of Afghanistan's approval to do that. So on September 25th, I'm setting the conditions with General Petraeus that as a result now of about 60 to 90 days of looking at this fairly hard, we now believe that it's all the way to the top with General Yaftali being involved, and we're going to have to probably seek his removal. That continues for about another 30 days, and then on the October 24th, Colonel Fossil sends me an email, my command IG, and he explains to me that, sir, we've been in to brief the Chief of Staff of the command, which they had direct responsibility under on a day-to-day basis, and we have a problem with the pharmaceuticals that are going to require outside assistance. We're going to need to go outside the command. I, at that point, read his email that he said, we're going to develop a course of action. We're going to go in and brief Dr. Kim, who was my civilian deputy, as soon as they could get him back from the trip he was on at that time. He came back on October 28th. They went in and briefed him on October 28th on the situation. As it has been said, it was clear that we're going to need outside assistance. and that initial notification was made to the Department of Defense IG that we were going to need outside assistance to help us deal with this. The ultimate objective being, we had hoped that we would be able to remove a leadership at the top of the entire medical system, which was, in this case, General Yaftali, and therefore we wanted to make sure we had some good information. At that point in time, when the email was sent that night, we had not yet finished the necessary and critical coordination that I, the month earlier, had shared with my whole command team and with General Petraeus, was that to remove General Yaftali is going to eventually require the President of Afghanistan's involvement. So at that point in time, we went ahead and made I told the team, let's finish the necessary and proper coordination, and as soon as we have that complete, I'll make this an official request back to the Department of Defense IG. Meanwhile, the coordination continued with them, both from within my own staff and then personnel I had back here in Washington conducting our semi-annual programmatic review being held here in Washington with about 150 different personnel from across the U.S. government that were there to include the Department of Defense IG. So we finished that necessary and critical coordination that needed to be made, reaching the President of Afghanistan finally, knowing that he's been notified on November 9th, and then on November 10th, that request was then sent as an official request to the Department of Defense IG, asking them to come on over and assist us in this investigation.
I thank you for sharing that. I have a series of questions that my time has well expired. Let me recognize first the Ranking Member Tierney.
Oh, thank you. General, so you came in 2009?
That's correct.
Right. So obviously this isn't a problem that started the day you came in. So I'm curious to know what information was provided to you upon your assumption of the command. I mean, did you have reports indicating rampant corruption, problems of the nature that we saw in the photographs that were displayed here? What was the state of play when you assumed command?
We knew, like always, there was challenges with patient care, but the images that we saw this morning, the patient neglect, the first time that was ever brought to the command's attention or shown to the command was on November 10th, when my command—
What year?
I'm sorry, Congressman, on November 10th of 2010.
So there were no reports in 05, 06, 07, 08, or 09 to anybody in your position or your command structure of those types of conditions?
I didn't necessarily thoroughly review every previous report for years before I went over there specifically about possible patient neglect in the hospital. I was aware generally of the aspects of the medical care inside of Afghanistan and the system that we're using, so that within the first 30 days there, some of the immediate critical people that I went back to General McChrystal on and said that I absolutely had to have assigned to my command involved getting some additional people to work in the medical system.
So I guess my question is, obviously these conditions are pretty obvious to anyone. Now, we had a number of mentors and people in the facilities. They may not have been performing the care, but they were there and they were observant or able to observe all of this. What do you think is the problem with our system that nobody raised this to the appropriate level of attention for people in a command position?
Well, again, about all I really know is that the first time, my command—
I'm just talking structurally here. I'm not asking why a particular individual may not have anything, but is there something wrong with the way that we're operating and the way that our command structure is that something like that wouldn't be reported up with some alarm?
No, what I would hope, the reason it was reported up, I mean, it was my command that identified and reported this to our command leadership on the evening of the 10th of November. And again, the second it was identified to us, we took decisive and immediate action. I mean, it wasn't a question of—
I'm not disputing that. I guess I'm disputing is you weren't the first guy at the rodeo, so what happened to the others? Is there something structurally wrong that the others didn't feel as compelled as you did to bring this forward?
Well, Congressman, if I could say, there are a lot of people that went through that hospital before that time period. There were always challenges with patient care, but none of us going through that medical hospital prior to that then had seen the patient neglect that we saw in those images that were just on the screen. I mean, I can, there's time periods during 2010 when I was in that hospital. And when I would go, I'm not naive enough to not realize that when somebody knows I'm coming someplace, they're going to have a set schedule for me and things that they want me to see. And so I did deviate each time I went through that hospital and was visiting there to look for other things and just to get my own personal assessment of areas that they weren't prepared for me to go to. My command sergeant major, my senior non-commissioned officer, went through that on a monthly basis, and clearly they didn't prep for his visits. You know, there were a lot of external looks that were going on in addition to those. Part of our challenge was we didn't have the number of people in the hospital really providing the oversight inside the hospital until about August of 2010, when we first really put our first 2 mentors in on the wards and started giving us some real day-to-day look at what was going on in that, because we just didn't have the depth.
So prior to that, the people had been doing their mentoring off-site?
Off-site or over in different headquarters or different locations. And again, we also had the 6 regional hospitals, too, where we operated out at. You know, part of our focus that year, and again, I give great credit to my command surgeon for doing this in 2010, was he implemented that year 2 really critical programs. One was we recognized that all the work for these previous 8 years of trying to develop doctors was failing. It was a waste of U.S. government taxpayer money to take the time to educate a doctor, because what we found was in the end about a third went AWOL, and then the others would refuse to take assignments to the difficult locations where they needed to go. So in recognizing that we're dealing with a country that probably has one of the poorest health care systems in the entire world, we decided to develop a physician's assistance course, something that would be much shorter and would give us much greater numbers to get out to provide immediate care to much larger numbers of the Army team in the Afghan security force. And so in 2010, we implemented the first ever physician's assistance course, put that into being, and it was in full operation by that fall. We start the first real combat medic courses. Again, a trait that we had learned with the U.S. military members was if you have very good combat medics down on the front line, when somebody does sustain an injury, that immediate care on the site can really make an enormous difference in their long-term survival. And so we implemented a very rigorous and deliberate combat medic course that year. And that was in full swing to the point where by the end of 2010, not only had we implemented it, which was always important, but as we talked about teaming with the Afghans and setting the conditions for transition, we had also set the conditions up so that they now, by the end of 2010, were teaching the course themselves with us just providing oversight and on-the-spot assistance, which was an enormous step forward for a country that never had this kind of capability before. So there are many things being done in the medical system with the folks that we had trying to provide greater care for the military soldiers.
Thank you. Yield to the Chairman.
General, you said that you took, when you knew there were problems, immediate and decisive action. Yet we had 3 colonels come testify. That's exactly what didn't happen. Are they wrong?
Chairman, what I can tell you, and I can validate it with the emails that we've been able to provide for you so you can read the actual discussions ongoing, of which the members that were here before you were also on those exchanges. On the evening of the 10th of November, in a teamed effort between the Ministry of Defense IG and my command IG, who went over to do a spot check of the hospital, they found those unacceptable conditions as you showed on the slide there. They brought it back, immediately brought it to General Naismith, who was the brigadier general, the 1-star who had oversight for all the advisors and trainers inside, or all the advisors inside the Army team. As soon as he got that note, and it's interesting to note my IG did not include anybody in the medical team on that note to him, he immediately took decisive action. He didn't have to brief anybody else on our command team. He knew, and again, nobody had even seen photos at this time. He was acting off of my command IG saying, I've gone over to perform my duties as I'm supposed to be doing, had taken my Afghan counterpart to teach him how to do this, and here's the things we found. There's no hot water in the hospital right now. The boiler is down. I'm seeing, piles of, as he described.
And this was known months and months in advance. This is not new revelation as of November. With all due respect, General, this had been highlighted for years in problems with the IG reports, and it was specifically highlighted with Colonel Carrozza in his August memo to you. You highlighted this with General Petraeus. The problem is when Colonel Fossil sends a request asking he sends an email on October 28th to Ambassador Moorfield. I'm writing to request your assistance with an inspection investigation. It goes on. Later, he has to write an email. I spoke with Lieutenant General Caldwell this evening about the email below. Lieutenant General Caldwell respectfully requests we not move on this request for assistance.
I think if you read the rest of that, Chairman, it says until he makes notification to General Petraeus.
Which you had already, it does say request for assistance until he briefs General Petraeus. But it's also clear that General Petraeus was briefed in the months before. There was no new information for General Petraeus.
Chairman, if I can just help with clarification, we're talking two issues. We're talking corruption and we're talking patient neglect, very separate and distinct issues. All of the email trails through the period of August, September, and October are on nothing but corruption. Not one of them from any member of any staff ever talks about patient neglect. And I have been unable to find any discussion whatsoever in going back through briefing slides of briefings that my command surgeon gave to me, that my command surgeon gave to General Petraeus, that my IG reported during that time period. There's not one thing I can find during that, but I can find lots and lots and lots of discussion between all of us because we recognize that the corruption that was in that system emanating from what we determined to be the command surgeon, General Yaftali, was in fact eventually leading to the challenges that we are having with patient care in the hospital. I'm not talking about patient neglect, but just routine patient care. The apathy of the doctors and some of the nurses, the inability to make sure that they're doing their work times, the constant work we had teaching them about cleanliness and standards. You know, what's interesting is I talked to some of the advisors who had been in that hospital for many years, retired military surgeons. They would, you know, as we talked about, well, why aren't they doing more cleaning? You know, one of those retired command surgeons looked at me and said, well, you do understand, sir, 3 years ago you wouldn't even found a bucket and a mop in here. Now there's a bucket and a mop that's used a couple days a week. We've just now got to get them to use it multiple times a day.
We're way past your time, but to clarify, in your September 25th email to General Petraeus, you say, quote, activities include diversion, hoarding, and theft of U.S. and Minister of Defense purchased medication, resulting in hundreds of ANA soldiers being denied treatment.
That's right. The proper patient care, that is correct, Chairman.
But what you said was there is no evidence in any of these emails indicating that there was any patient neglect, not getting a pharmaceutical, not getting an anesthetic during surgery, not getting, I would think does highlight the fact that there was an awful lot of neglect and abuse going there, and that's precisely what you, in your own words, said to General Petraeus back in September.
Right. And that's correct, Chairman. I'm talking about patient care, and I'm talking about the fact that they need pharmaceuticals down at the lowest patient level, that we need to use all the proper hospital equipment and supplies that we're purchasing and making available to them. And it starts with, and I was concerned about that corruption, but I am talking about patient care. The pictures that you showed, Chairman, if I could just try to help, please, to clarify this, that's patient neglect. That's unacceptable. There is nobody in a uniform that is going to see those kind of deplorable conditions and accept that. And I can assure you that.
But that's precisely what these colonels said, saw, shared with you.
No,
that's why we had 3 colonels come before this committee and saying that you were the one that was preventing bringing in additional resources. That's why we're here today. That's why you're here.
Chairman, I understand that. And what I'm trying to help you understand is the facts as they actually occurred. I don't question for 1 minute that everybody was very concerned. But I'm concerned at this point that people have gotten their dates and events and activities confused. And I'm trying to use the emails to help provide factual timelines for you as to who brought what to what person's attention and when they did that.
If I reclaim my time, just which is a bit over on that, you're making a distinction, General, between neglected patients and corruption. And you put the lack of pharmaceutical supplies getting to their end patient under the corruption aspect umbrella of this. And not necessarily the patient care or neglect, as we said separately. Was it the second end of it that you felt hadn't been fully reported to General Petraeus, and was it that you wanted to get reported to him before you went forward with the IG?
When I wrote that email on September 25th, I was trying to set the conditions with him that we thought we would eventually have to go to the President of Afghanistan to seek the removal of the Surgeon General of the Afghan Army, because we felt he, in fact, not only was involved in corruption, but also was setting the poor overall care.
And that had not been brought to the General Petraeus prior to that?
I think everybody knew we had challenges all the time in the medical system. But in fact, I was the idea of the corruption emanating all the way, at this point we had decided, to the top of the ladder to the Surgeon General of the Afghan Army. I do not know of anybody prior to that bringing that to his attention.
Thank you.
Thank you. I know the gentleman yields back, but one of the frustrations we probably have on both sides of these aisles, you said that these emails and documents provided for clarification. We got them at 4 o'clock yesterday, roughly 80 to 100 documents, despite this committee requesting to get those emails and all of the information so this committee could review it. This is an ongoing practice. It goes above and beyond what happened here in this situation, but it's unacceptable. The committee cannot do its job unless 100% of the documents are provided to this Congress. This has happened time and time and time again. It's wholly unacceptable. And, General, it's very frustrating for you to cite and say, well, we provided these emails for clarification when we got them at 4 o'clock last night, and we've been looking at this for months. We now recognize the gentleman from South Carolina, Mr. Gowdy.
Thank you, Mr. Chairman, and thank you for calling this hearing and the previous ones that you have. And I want to thank my friend from Idaho for letting me go ahead of him despite his seniority. And General Caldwell, I want to thank you for your service to the country. And then I want to get into the chronology. It seems to me that on September the 3rd, 2011, an article that negatively portrayed the hospital and our involvement with it appeared in the Wall Street Journal. Now, Chairman Chaffetz, I missed part of your opening statement. Would you be gracious enough to perhaps share just a couple of the more salient examples from that article about abuse and neglect at the hospital? Just a couple if you have them. I apologize, I was in another committee hearing when I missed it.
There were a series of very graphic photos and very specific allegations of patient neglect. And the other thing I would highlight here is that on September 3rd, General, you sent to General Allen an email about the Wall Street Journal article and said, quote, did not contain any of the items concerns we had previously discussed. Rather, it focused on NMH and Afghan leadership. You also stated it's clear that the author, Maria, was provided emails and internal briefings and pictures by someone within the command, which confirmed that we have all suspected from earlier discussions. It was obviously clear to you that there was a lot of patient neglect going on. This goes back into September 3rd. And yet you testified, my concern is the General just said that he had no emails, no information that this was happening.
So, Chairman, if the chronology, if my chronology is correct, we have a negative article on September the 3rd, 2011. We have a letter from our colleague, Congressman Kaufman, on September the 7th, 2011. We have an article in the Army Times on September the 11th, September the 7th, 2011. And then we have a new policy promulgated, a memorandum that sets forth a new policy, Chairman Chaffetz, not surprisingly, on September the 12th, 2011. So in the course of less than 10 days, we have a negative story, a congressional inquiry, an article in the Army Times, and then we have a new policy. So, General Caldwell, my question to you with specific reference to this policy, one of the goals of the policy is to promote a positive image of coalition forces. And this memo is specific with respect to persons assigned or attached to Command Surgeon Medical Training Advisory Group. Wouldn't you be more interested in an accurate image being portrayed as opposed to a positive one? I mean, if the reality is bad, then why is it so important 9 days after a negative story to stop the photographs?
Congressman, at the time, I was not aware of this memo. I've been made aware of it since. I do know that last week this committee did get deposition from the command surgeon as to the chronology and events and activities starting around the, I believe it was the April 2011 time frame when this memo.
Would you agree with me it is more important to show a realistic, accurate portrayal of what's happening as opposed to just wanting to focus on the positive? I mean, we would all like to live life only highlighting the positive, but that's not, I mean, that's not our job on this committee. We're interested in what was really happening. So why 9 days after a negative article do we get this memo restricting what can be disclosed and telling folks that we want to assert a positive image?
Again, Congressman, I didn't review the memo. I wasn't associated when that was released while I was in command there. But my command surgeon did start putting that memo together back in the April time frame, and it took many months before it was completed because of the reviews that were done all the way up to the CENTCOM headquarters to ensure the proper wording and clarification as to what was being sought after. And the intent behind the memo, as I now understand it, and again, she gave deposition to this committee last week in pretty exhausting detail, as I understand, explaining everything about this memo, but was that her goal was to ensure that we weren't violating any privacy rights of individuals.
And, General, I agree. That is a worthwhile goal. It just makes me wonder why it took so long to promulgate a memo to protect that goal. You see, my point is the chronology. Negative story, let's issue a memo that makes sure this never happens again.
But again,
you're talking about patient protection. Patient protection was just as important an issue the day that we showed up at that hospital. It didn't just become important in September of 2011. It's the timing of it. That you don't have to be cynical or skeptical to question the timing, the chronology of this, I don't think, do you?
I believe, again, Congressman, that this memo started being drafted in April, and it took about 4 months. There was absolutely no connection, as I understand she said in her disposition, between when she finally got it back approved for release by both the ISAF headquarters and the CENTCOM headquarters, who had to review it and approve it both through legal channels and up there before this could be released, and when it got released. There, as I understand from her, that there was absolutely no correlation between the two.
But when you see a negative article in a widely read publication, you have a letter from a member of Congress, you have an article in the Army Times, and within the course of less than 10 days, you have a memo telling people to do things differently and promote a positive image, you could see why we might be skeptical of that chronology.
Right. Right. I think the intent of her memo was telling people that let's respect the right of each Afghan citizen. It's a sovereign nation you're operating in. If you have photos that we think we need to record and provide, let's do it through official channels. There's no objection to doing photos, but if we are, they need to be done in an official manner, properly controlled through official channels.
And I agree with all that. It just makes me wonder why the memo wasn't promulgated a lot sooner. Those are very important concerns, so important that you would want that memo out maybe the day after the thought crossed your mind that we want to protect patient security. I just find the chronology to be curious.
Within 30 days of her coming in and assuming her job as the command surgeon, she identified this as an issue that had not yet been addressed. And she
Who was her predecessor?
Was Colonel Geller.
He did not think patient security was as significant an issue as she did?
I can't speak to his thought process. I can just tell you she identified this within 30 days of her taking over as the command surgeon as an area that had not yet been addressed by somebody, and she took it on to make sure that it was properly addressed.
With the gentleman yield,
Sure.
General, why was it the policy that the photos should be destroyed? Why destroy evidence? Why not turn this over to the Inspector General?
I think, and again, as I've, after the fact now have read this memo, as I understand the memo, it says,
but General,
if you have photos, turn them over to official authorities. It doesn't, it said if there's a photo that's, that needs to be retained, it needs to be retained in official.
No, it doesn't. It says unofficial personal photos or video or audio recordings of patients or healthcare events taken by personnel subject to this policy, which already exist, will be destroyed or deleted.
Right. I believe it's either the paragraph right before or after that one, Chairman, that is clarifying that if you have personal photos that need to be retained in an official manner, to please do so.
We'll dispute that. I think it's in black and white. We'll look at this. And I guess one of the questions, we're well over our time here, is how is it that it takes 4 months to issue a memo, and you're the commander, and you didn't even see it? You say you had no idea that this went out. I've never read it. I didn't know about it. How can that be, that it goes out on your letterhead, and you say you don't even know about it?
Chairman, there's a lot of things in the command that I would expect my subordinates to do the proper and right thing. And if they're doing the proper and right thing, they don't have to show me everything. If they believe it is something that is contrary to what we've done before, or is a change or something, I would hope they would bring it to my attention. But she had this fully within her authority as the command surgeon, and I would have expected her.
And Colonel Fossil did not have the command or the authority to ask the Inspector General to come in and help him out?
No, he would have absolutely had that authority.
You pulled it back.
Our command was making a request to request outside assistance on October 28th. And when they did, and we had not finished the necessary and proper coordination, we had not notified the Minister of Defense, and we had not told the President of Afghanistan. Again, I go back. You asked me why my statement, Chairman, was written as it was, because if you don't understand the tenets on which we were operating under, the idea that we team with our Afghan counterparts, that we have transparency with them, that we're not going to try to do something that we're not going to look them in the face and say, you've got a corruption problem. I had been telling the Minister of Defense and his key officials, but we had not yet gone to the President of Afghanistan and also told him. And so we asked them to make sure that he was told before we made that. But it did not stop any of the ongoing coordination that occurred between the Department of Defense and our team. In fact, on the 4th of November—
I guess I would disagree with that, General. I would disagree with that.
All right.
But we'll continue to explore. We've gone way over time. I thank the gentleman from South Carolina.
I thank the Chairman, and I thank the gentleman from Utah for his indulgence.
We'll recognize the gentleman from Massachusetts.
Thank you, Mr. Chairman. General Caldwell, I want to put this in context. Your responsibilities at the time all of this going on is not just for training and the oversight of Dawood Hospital, but also what else were you responsible for?
Congressman, I had the responsibility to literally to recruit, train, equip, man, and to professionalize an entire Army, a police force, and an Air Force, to also help develop 2 complete ministries, the Ministry of Defense and the Ministry of Interior, and built all the supporting associated systems that support all those entities.
So what's the size of your command, personnel-wise?
Personnel-wise, I've got about 7,500 personnel that on a day-to-day basis that are working with us to help us accomplish that mission, but a large Afghan contingent that works daily.
Yeah, what's the size of the I know all the members on this committee have been to Afghanistan many times, including myself. How many trainees, how many recruits are you talking about on the Afghan side?
On a daily basis, we probably had, when we were up to full production, about 24,000 Afghans in some sort of a training program.
Okay. As has already been talked about here, we're talking about the 4th poorest country in the world, Afghanistan. The literacy rate, the last numbers I got from being over there was that literacy rate among males is about 17%, females is about 10%. From my own observation, no reliable infrastructure. I think 92% of the country has no electricity. And corruption, I wear a couple of hats. I've also served on the terrorist financing task force here in Congress. And having been over there many times and dealing with that problem and the problem with the Kabul Bank, I honestly believe that, well, corruption is to Afghanistan like wet is to water. It is rife with corruption. And so I understand the context in which all of this is going on. And I want to get right at it. There were some allegations in the previous hearing, and they're part of this investigation, that General Caldwell, you may have inappropriate delayed a request to the Defense Department Inspector General based perhaps in part on his concerns about the 2010 election, congressional elections, your concerns. The Command Inspector General testified that you brought up the elections and expressed your concern due to your relationship with the President. Now, look, I have followed your career. You have had a distinguished career serving this country. I'm going to ask some questions about this, because I don't want you leaving this room without clearing this up. The allegation of interference under investigation by the Inspector General basically says that you delayed this request because of your concern for the election. And I want to ask you right now under oath, did you make these statements?
No, I did not.
Okay. Were there any other statements that might have been construed as being the underpinnings of these allegations?
Congressman, on the 28th of November, October 28th, when my command sent that request to the Department of Defense IG, we had not yet finished and completed the necessary and critical coordination with the Ministry of Defense and the President of Afghanistan. I had not yet even come back to my boss, General Petraeus, even though that email unfortunately said we don't have to inform General Petraeus. We may not have to, but I would think that as a good subordinate commander seeking, I'm going to need his help to remove this Surgeon General. It's going to have to go to the President of Afghanistan. I will desperately need General Petraeus' help. So I absolutely do want to inform him because I'm going to need his assistance one more time, as I told him the month before that I'd be coming back for his assistance if it got to that point. So on that evening, because we had not finished the necessary and proper coordination, I told my IG, and again, I've got the email I can share with you exactly what he sent back to the Department of Defense IG, saying that I do concur with the substance of this request, but again want to finish the coordination. And there's an ongoing dialogue that takes place that night between my command IG and the Department of Defense IG that supports that. And again, you know, it concludes that evening with my command IG telling the DOD IG, thank you for your timely response and understanding. Appropriate staffing of this request will occur internally tomorrow. Lieutenant General Caldwell will inform General Petraeus of his concerns. So I think my command IG knew exactly where I was coming from because he was able to convey that to the Department of Defense IG as to why I wanted a few more days before we, quote, made it an official request to move forward. But it did not in any means not enable us to continue the coordination. In fact, my Deputy Commanding General for Programs, who was back in the United States at that time, met with and also talked to the the Department of Defense IG that next week on the 1st or 2nd up in his office to continue the dialogue about this request. Because we were moving forward with it, we just wanted to give the opportunity to make sure we had informed the President of Afghanistan. In the ensuing discussions, as I was explaining to my IG, when you don't do the necessary and proper and really critical coordination here in this, you can have second and third order effects. And it was in that second and third order effects that I said, and there's a lot of things going on, like the elections in the United States and other things where there may be somebody who would want to take and try to perhaps use it in a way that was not intended to be. And so just do the necessary and critical coordination, and there won't be any unexpected second and third order effects if we do that, which we're supposed to be doing. It had everything to do with the necessary and critical coordination and absolutely nothing to do with the national elections.
Mr. Chairman, I just ask for indulgence to continue this line of questioning. I mean, we've gone on over the time limit on a couple of occasions here. General Patton, I want to ask you, there were also allegations at the previous hearing that you may have communicated a similar message to people that you were working with, subordinate officers in particular, about the importance of the congressional elections and the conditions and the requests that were due to be made with respect to the Department of Defense assistance in this case. Did you make any statements to that effect? And if you did, why did you make them, and what were they?
Congressman, thank you for that question. I never directed subordinates nor received orders from superiors that a request for DOD-IG visit be either delayed, impeded, or avoided for any reasons, to include political reasons. The subject of the elections was briefly discussed and dismissed in a staff meeting that I chaired on 29 October. And as Congressman Tierney mentioned in his opening statement, my recollection of that meeting was that the subject of the elections was discussed and dismissed, discussed very briefly and dismissed, and had no impact on my decisions or actions that had to do with the DOD IG request. We turned our attention to the focus of the meeting, which was, as General Caldwell explained, developing a strategy for the notification of the Minister of Defense and senior Afghan officials so that we could gain their support and cooperation with a DOD IG visit. And we thought that was a critical condition that needed to be set in order for any visit to the hospital to be successful. So we really set about, that was our primary focus of that meeting. And that recollection is also shared by, and it's consistent with the recollection of Coast Guard Captain Steve Anderson, who testified before this committee on 24 July, in that the subject came up briefly and was dismissed, and we moved on to other subjects in the meeting. And I would say that the discussion, it surfaced in a discussion on the operational environment at the time. The elections were occurring within the next week. The other things within the operational environment we discussed was the Islamic holiday of Eid, which was occurring around the middle of the month.
Okay, I think you've answered my question. Ambassador Moorfield, sir, can you recall at any point, at any time during your inspections and site visits, did you receive any information that General Caldwell or General Patton were attempting to interfere with your efforts based on the election or otherwise?
Mr. Congressman, thank you for the question. No, we never received any indication that that there was any attempt ongoing to delay our investigation or even turn it off. In fact, when we originally received a message from Colonel Fossil, I think it was the 28th of October, and notwithstanding his subsequent message that they would like to have time to take care of certain internal business with respect to General Petraeus, and I can't remember exactly what was in every message, but I know I talked to a number of officers in the command. In any case, also to get General Wardak, the Minister of Defense, on board. These were not unusual requests. They appeared to be in the context of trying to enhance the prospect of the success of the initiative. And in any event, we were on a very fast track trying to organize ourselves to deploy, which normally would take 1 to 2 months. And although I wasn't exactly certain on October 28th the timing, but we were preparing ourselves to get out there right after Thanksgiving, which is what we did.
Okay.
Be happy to come back to the gentleman if I could. I'd like to recognize, if I could, the chairman of the full committee, Mr. Issa.
Thank you, Mr. Chairman, and I'll be brief. General Patton, General Caldwell, Ambassador, have each of you received, because you do operate in assignments that require that you be nonpartisan, nonpolitical, have each of you received throughout your careers information and orientation about that requirement?
We have, Chairman.
From the time you were a butter bar, right?
From the time I was at West Point, that's correct, sir.
Oh, I'm sorry. I don't go back to plebe, but yes.
Sir. Yes, sir.
General Patton.
Yes, Mr. Chairman.
Mr. Ambassador.
Yes, sir.
So, for the record, it is, in your words, I would ask you each say it in your own words, it is inappropriate for anyone in the uniformed services or anyone in the State Department to ever do anything that affects or could affect U.S. elections as a consideration of their required duty. But please use your own words of where you think the prohibition is based on that training.
Mr. Chairman, you're exactly correct. It's inappropriate for us ever to allow any kind of political influence whatsoever to ever enter in any kind of decision-making process or actions that we're taking.
General Patton.
Mr. Chairman, I would echo that at no time should a political factor such as the elections enter into our decision-making or influence our action.
Mr. Ambassador, you have a slightly different set of guidelines. Would you please give us your interpretation?
Well, thank you, Mr. Chairman. Actually, I was a military officer, too, so as far as I was concerned, that ethos carried through. When I was a Foreign Service officer, we were apolitical and dealing with the substance of issues, not in any way related to the political environment.
Okay. Well, hopefully each of your words will be echoed through the uniformed services and the State Department, lest anyone have a different view. I have historically viewed military people to be so apolitical that it's only in the deep dark of late in a Codell that someone will say, you know, I'm actually a Republican. And that's about it. And to the great extent, the non-political appointees of the State Department. I'd like to take an opportunity, even though it's not the subject of this hearing, Ambassador, on behalf of myself and I'm sure every member of Congress, to express our condolences for the loss of your colleague. I knew Chris working that region, and it'll be a great loss to the State Department. And I think that we all feel from the dais. And Mr. Chairman, I yield back.
I think we now recognize the gentleman from Idaho, Mr. Labrador.
Mr. Chairman, I just yield back.
I'd like to, if you could yield to me for a second, I'd like to, consistent with where we were going and what we're doing, I'd like to show, there's two clips, and I'd like you, without filtering for myself, I'd like to show you those clips. Hopefully the audio will be adequate from our previous hearing, and then have you respond to each of these. Recognize myself. I want to pick up Colonel Fossil on where we were before. You had made a recommendation, a formal recommendation, to bring in help, support, IG. What happened when you made that request?
Thank you, Mr. Chairman. As I talked about previously and touched on it, the request that I made to Ambassador Moorfield went forward, and then I was told by Lieutenant General Caldwell and staff to retract it, and I did that by telephone and later by email.
What specifically did he say to you, and what was his justification for not doing this?
Prior to that, there was a meeting. In fact, there were two meetings, and I don't think we talked about those, but the first meeting involved myself, Steve Anderson, Schuyler Geller, Marion Amrine, General Patton, Lieutenant General Caldwell, and that's all I can recall right now. But that meeting is where General Caldwell came in, and he was visibly upset that we had made the DoD IG request for, and at that time, an investigation or assistance visit, an inquiry, due to the circumstances in the hospital.
Why would he be upset about that? What did he specifically say?
After that meeting, there was a shorter meeting in his office, and that was between me, obviously Lieutenant General Caldwell, Colonel Bush, his Chief of Staff, and Lieutenant Colonel Brett Sylvia, his military aide. And he was visibly upset, again, because I don't think that, and this is my conjecture, that Dr. Kim and him had a chance to talk about this situation in the hospital, okay? But his first response to me was, how could we do this or make this request with elections coming? And then he made the really, again, shocking comment that he calls me Bill.
What does that mean?
Well, I took it as that he was referring to the President of the United States.
General Caldwell, your response?
Thank you, Chairman. There's about three things there. One is, and I'll try to walk through them as he made different statements there. One was that he was told to retract the request for the IG assistance that we're requesting. And in fact, I think in his own words, he writes, I'd like to quote, because this is important to know what he said at that time. He perhaps has forgotten, but I'd like to be very clear. He said, I spoke with Lieutenant General Caldwell this evening about the email below. That's the request for the DODIG assistance visits. And he says, Lieutenant General Caldwell respectfully requests not to move on this request for assistance until he briefs General Petraeus on this issue. He agrees with the substance of this email. So I just, the wording that he used was not the wording that he used that night, and going back and explaining to Ambassador Moorfield what we were trying to do was set the conditions, and so we were asking him to hold on that until we had finished all the necessary and critical coordination. The second one, when he said he had not talked to Dr. Kim yet, that is an accurate statement. Dr. Kim and I had not talked at that point in time, so I was not aware of the earlier afternoon meeting that several of them had had with himself. I don't recall the first of the meetings he refers to there, but I do recall the second one when he was in my office, and as he says, I was upset, and I can tell you I was very concerned. I was upset, and the reason I was is for three reasons. And the first one is we had not yet set the conditions to team with our partners. So I hadn't informed General Petraeus, my superior, that we were going to bring an outside agency in and seek assistance, which would eventually, the only way this would succeed, the reason we were bringing this outside team in was to seek the removal of General Yaftali. And so if we didn't bring General Petraeus in, the ultimate goal of bringing this team was to remove Yaftali and expose this corruption. And I would need the President of Afghanistan to acknowledge it and not deny it in the end. And so, and again, if you look at the events that occurred in the previous few months, there had been some death of Afghan civilians, accusations Americans were doing these things. There were some very tense relationships between General Petraeus and the President of Afghanistan. So I wanted to make sure General Petraeus was aware that we were going to bring this organization in to help assist us, which eventually, the end state being the removal for sure of Yaftali, and then obviously the ability to now start fixing the medical system. I also wanted to include our Afghan partners. I was upset because I had not gone back to the Minister of Defense and told him I'm going to officially do this. He and I, along with General Patton, had been talking to him for some time about the corruption we were seeing. He himself had launched his own internal investigation based on information we had given him, and yet they had not been able to bring it to a point where it would enable them to remove him. So I wanted to make sure he was on board. The second point was, it stated in the email that he wrote that evening back to Ambassador Moorfield that we did not have to have, he said, P4's approval, referring to General Petraeus. We may not have needed General Petraeus's approval, but the ultimate objective of what we are trying to achieve through this would never have occurred without General Petraeus's involvement and association with this effort. I needed General Petraeus's help, and he was the senior commander, and if nothing else, out of just due courtesy and respect, I owed him to tell him what I was doing as I was doing it. So I was upset that he would say that when he full well know that, again, I go back to my three tenets. The tenet of transparency. Be transparent with our Afghan counterparts. Be transparent with my boss and what I'm doing. Team with my Afghan partners, one of my tenets. We weren't doing any of that. And then the third point was it contained inaccurate information. He specifically states in that email when he writes it that, again, we met with Dr. Kim today, and he has briefed General Caldwell on the prospect of this DODIG spoke conducting this inspection assessment. Lieutenant Colonel General Caldwell and Dr. Kim welcome your involvement. Well, that was an inaccurate statement. I had not yet been briefed, and I did not yet know about this. And so we were, in fact, telling the Department of Defense IG's office something that was inaccurate.
Wait, what was the date on that again?
Again, this is the evening of the October 28th.
Did you, but on September, the first week of September, you had a Wall Street Journal article, the things that Mr. Gowdy talked about. You telling me you just dismissed that? I mean, you sent it to your commander.
Chairman, if I could, I believe you're referring to 2011, not 2010. I don't want to correct you.
No, I want you to. I want to get this, I want to have this clarified.
No, I think the Wall Street Journal article occurred in 2011.
Exactly.
This was still in 2010. And so I was upset with my IG because for the sake of just a few hours, I was returned that evening from traveling to one of our training sites inside of Afghanistan, coming back to the headquarters, and everybody knew I'd be back that evening. For the sake of a couple hours, we could have waited and brought me in and briefed me. And my first response would have been, we absolutely need to do this. We've been talking about doing this for months. We've set the conditions with General Petraeus. Let me now write them. In fact, what I do the very next morning, Mr. Chairman, is I send General Petraeus a very detailed note explaining to him that we're going to do this, seeking his approval, let him know we want to move forward. And simultaneously, General Patton, and he can talk about it, he pulls the team together and starts all the internal coordination that we're going to do to make sure we're teaming with our Afghan partners and being very transparent with them and how we're going to move forward. Again, if we're going to do this, we want to remove General Yaftali. That was absolutely essential. If he was not removed, anything we dealt with down at the lower levels would have been for naught. It would have been a temporary fix, and the corruption would have crept right back in.
And General, with the benefit of hindsight, granted, I'm not there in real time dealing with all the other headaches that you have. This is not the only thing that was on your plate. Granted, I understand that. What I think is a disconnect for me, in at least your approach there, is that one would exclude the other. It seems to be that bringing in the resources of the Inspector General would add to the case your ability to be more transparent, to understand what was happening in this situation. You knew from the beginning of your command that you didn't have the resources you needed to uncover all the corruption, again, not just at this hospital, but throughout the government. And what is concerning, the reason, and again, if we had one colonel express an opinion, of course we would listen to that. When you have 3 colonels come before us and say this was just absolutely untenable, and we did not get the resources, we did not have the support, we did not move as swiftly as we can, we were not as transparent, that's in part why we're doing this investigation. So with all due respect, I've gone way over my time. General, we'll give you ample time to continue to respond, but let me recognize the ranking member, Mr. Tierney.
General, what was the time lapse between the time that you asked to retract the email to the Inspector General and the time that you sent an email or directive to go ahead and invite him in?
It was about 12 days, Congressman.
And is there any discernible circumstance that changed inalterably because of that 12-day period?
No, again, we used that 12 days. During that 12 days, we continued all the coordination with the Department of Defense IG. That dialogue and discussion continued not only from my own staff from inside of Afghanistan, but also with my team that was back in the United States. So when we said hold, it didn't mean stop working it. We kept working it the entire 12 days. And then with the Department of Defense IG, while simultaneously also doing all the necessary and critical coordination inside of Afghanistan, of which General Patton was doing with the entire Ministry of Defense.
Ambassador, would you have been, or your team been in Afghanistan any sooner had that 12 days not lapsed?
Not in my experience, Congressman Tierney. It normally takes 30, 45 days under the best of circumstances to organize and deploy a team. And in any case, for this specific mission, I had reached out to the Surgeons General of the Army, Navy, and Air Force requesting subject matter experts, so we were working that side of it, which was also a key component of our ability to properly carry out the mission. So, no, we were in full-bore preparation for the mission, and the fact that we actually got out there by right after Thanksgiving is the quickest we have ever been able to respond to any mission, including several previous ones requested directly by General Petraeus.
Any of you might be able to answer this question. It seems that our process had been at least to provide the funds to the Afghan government, and once it got into their treasury, so to speak, or whatever, we lost any control over it. Is that an accurate statement?
I know General Patton can talk to this because he did work the programs for a while, but what we did during the time period I was there was we went ahead and tightly controlled the money and monitored it all the way down to the lowest level that we possibly could. One of the things we were trying to teach them was how to spend money, how to properly go through the process of accounting for, doing receipts, coming back and being able to audit yourself as you do the expenditures. So things that perhaps my team could have done for them, we tried to bring them in and have them team with us so we could teach them how to go through that system.
When it became apparent that some of this money was disappearing, I guess the question I have is, why do we keep giving them money?
Congressman, we continued to purchase pharmaceuticals so that we would ensure that there were pharmaceuticals available for the Afghan soldiers.
But they weren't. What the reports are that we're getting is that there was so much corruption that sometimes they were getting altered pharmaceuticals or fake pharmaceuticals, and that they weren't getting the kind of treatment that you would hope to get by providing the resources. So my question, again, is once it became evident that we weren't having those pharmaceuticals in their proper state get to the people on that, why do we keep giving them money?
And again, Congressman, there are plenty of examples I can give you during the 2 years I was there where we stopped providing fuel for aircraft, where we stopped providing the purchase of particular types of perhaps facilities for the Afghans when things didn't go well. I could let General Patton address it more specifically. He had direct day-to-day oversight more than I did.
All right. General Patton.
Thank you, Congressman. On the subject of the medical budget specifically, back in March of 2010, March is the month that is like our fiscal year. Their solar year begins and ends, and their fiscal system's based on the solar year. So March is the end of one solar year and beginning of another. And we noted that the medical side of the Afghan Army had under-executed its budget to the tune of 4%. That started giving us, that was a big warning there that they were not spending their funds. And again, part of making this an enduring system and solution in Afghanistan was to get them to understand how to manage their money, how to execute their budget. And we watched very closely the execution of their budget. And so when we saw that they'd only executed at the end of their solar or fiscal year 4% of their medical budget, we essentially took those monies back and reallocated them to other funds within the Afghan security force funds, namely to pay for payroll and other areas. And then we required the senior advisor to the medical system, Colonel Geller, to report back on a regular basis on how the medical system was executing its budget. There was some improvement there, but it was a continued point of sort of persistent effort with the Afghan medical team, and a persistent point that I made with the Afghan Minister of Defense, Minister Wardak, that and eventually in the summer of 2010 and into the fall of 2010 became a significant point where we saw the Afghans were under-executing their budget. We knew we were providing an excessive amount of pharmaceuticals in order to medicate a large portion of their Army, and yet we still had pharmaceutical supplies and medical supply issues and shortages in the hospital. And at that point, I recall the September timeframe of 2010 is when Minister Wardak initiated his own investigation in the Minister of Defense in order to look into the accountability of funds within his medical department and how those funds were being used or not used for pharmaceuticals, and then how those pharmaceuticals and medical supplies were being accounted for in the military medical system.
How did things change after General Yaftali got removed?
Sir, that was he was the root cause, and in my assessment, there was dramatic changes in the hospital when the Afghans removed him. And again, that was a presidential decision. But some of the things that we saw immediate improvement on: one, a patient bill of rights that General Yaftali had ignored during his tenure was immediately adopted by Minister Wardak and the new Surgeon General, General Totekel. And the patient bill of rights was essentially a statement by which each soldier, each patient in the hospital had it posted. It was written in their language, and guaranteed them that their bandages would be changed. They'd be seen, nurses and doctors would see them on a regular basis. Medicines would be made available. Fresh fruit and vegetables would be made available in their thing, that sort of thing. And that was a significant step in the right direction. A second thing that occurred in that time frame was the adoption of the doctors and nurses' letter of responsibility. It was essentially a policy that said that established the working hours for the nurses, established the working hours for the doctors, and established the responsibilities by which they would treat their patients. This had been rejected as a policy by General Yaftali. It was adopted by his successor and Minister of Defense. And this occurred in the middle of December in 2010. And then one other significant move with the removal of Yaftali, it was not only the removal of him, but also the replacement and reassignment of 20-plus other colonels and a couple other general officers in the medical system. And their removal, replacement, and reassignment essentially cleaned house. And then we used that opportunity. I remember meeting with every medical advisor in the week after that decision was made, and spent about an hour to an hour and a half with all the advisors, and said, we have to use this opportunity to drive positive change with the new medical team, the new medical chain of command, the new hospital commander, the new garrison support commander, and drive positive change with these people and the department heads in the hospital, so that the effect would be that patient care, that these systems would be put in place, and the result would be improved patient care.
What's the likelihood that General Yaftali is coming back, as some have rumored?
So that would be devastating and an unacceptable action at this point in time.
And is there any credence to the discussion that somebody may consider putting him back in?
Sir, I'm not aware of that discussion.
General Caldwell, you're not aware either?
Yeah, no, I'm not aware of it, Congressman, but I tell you that would be that is a red line from everything we saw and that we were able to produce as a result of the Department of Defense IGs being there with us for not only U.S. forces but all of our NATO partners too, to have somebody like that come back into that system.
Thank you. I yield back, Mr. Chairman.
General Caldwell, I'm sorry. I think we should probably recognize the gentleman from Massachusetts first. my apologies. Gentleman from Massachusetts.
Thank you, Mr. Chairman, and I'll be brief. One of the things that I keep that keeps coming back to me is the underlying premise of these allegations, which have been refuted, that somehow the patient care in an Afghan hospital treating Afghan soldiers and Afghan police officers, run by the Afghan Surgeon General, who was found to be corrupt and was removed, that the conditions at that hospital and the investigation, which was delayed by 12 days, somehow that was going to affect the congressional elections in 2010. I just find that very, very hard to believe. Health care was a big issue in 2010, but it was U.S. health care for the American people. That was a hot issue. So, you know, the allegation that this was somehow going to tip over the administration or you know, usher in a sea change in itself, I think is very far-fetched. And you know, General, I just appreciate you coming here and getting that cleared up, and I appreciate your service to your country. And I mean, we have problems in Afghanistan. We certainly do, and a lot of them are homegrown there. And you know, I think we have to reassess as we go forward about how long we're going to stay in Afghanistan. But that's a much larger question, and I certainly thank you for your service and your effort to help our cause in that country. Thank you. I yield back.
I thank the gentleman. General Caldwell, on September 3rd, 2011, you emailed a copy of the Wall Street Journal article to General John Allen. In the email, you said, quote, did not contain any of the items concerns we had previously discussed. Rather, it focused on National Military Hospital and Afghan leadership. What, if you recall what you were referring to, what was not talked about in that article? It was pretty extensive.
Chairman, the allegations that are here today that you're asking about were the same ones that reporter brought to me in that time period. And so out of respect to my boss, I notified him immediately that these allegations had been made by somebody to a reporter. She was asking me about them, and that my intent was to sit down and walk her through and share with her emails. That's the reason I have them still today, of these exact things you were asking me about.
And again, General, with all due respect, part of the challenge we have on this committee is you didn't provide them to us when we asked for them originally. It was 4 o'clock yesterday.
If I could, Chairman, there's an ongoing Department of Defense IG investigation into this, and I have previously, and again, I don't know the system that works after that, but I have previously provided all those it's still an ongoing investigation, but I did provide all those to them.
And I guess that begs the bigger question of why those, when we request within the Department of Defense to provide all the documentation, they continue and routinely prevent that information to coming to the United States Congress. We can't do our job unless we get that information. And it's a vital part of your perspective on this issue. Yeah, sorry, I interrupted. Continue. I don't know if you had anything to add to that, but I want to go to another part of this email. You said it's also clear that the author was provided emails and internal briefings / pictures by someone within the command, which confirmed which we have all suspected from earlier discussions, end quote. You can see our concern when, within days, there's a new policy that's issued that says you're not only to have these, but to destroy these photos. Rather than turning them over to an investigator or the inspector or something like that, destroy the photos.
And again, I didn't even know about that memo during that time period, Chairman.
If we can pull up document page 1, this one right here, Tom, I'm sorry. This is document page 1. I hope we get this right. Afghan General Yaftali was suspected of stealing millions of dollars worth of pharmaceuticals from the hospital as part of a culture of corruption. On or about December 26th of 2010, Colonel Amrine was tasked with sending, quote, everything we had on Yaftali, end quote, to the Inspector General. But according to a January 1st, 2011 email, General Patton, you directed her to, quote, reduce the documentary evidence that we provide, end quote. What does that mean?
Chairman, I have not seen this document recently, and I'm certainly not familiar with the specific context of it. I will say that I never ordered the destruction or delay of any documents pertinent to or requested by any investigation.
So here we have Colonel Amrine saying to provide everything, but she believes that you told her or instructed her, and I don't know how that happened, to reduce the documentary evidence. That's a fairly serious charge, sir.
Mr. Chairman, that's not my recollection. At the time, I was spearheading the effort to remove General Yaftali from his position. I had weekly, sometimes daily interaction with the Minister of Defense and the Chief of General Staff. I took volumes of material to the Ministry of Defense in order to secure the Minister and the Chief of General Staff support, knowing for the removal of Yaftali, knowing that they would have to take their request for removal to the President of Afghanistan. And that was, I would say I was, together with General Caldwell, leading the charge in the regard and in the effort to remove General Yaftali. So I would have been calling for as much evidence as possible. I personally carried evidence to the Minister of Defense, and it was all aimed at, with a bullseye on Yaftali's head, so we could remove him from his position and install a dependable and reliable Surgeon General that could lead then some of the changes we've described here this morning.
And again, Generals, one of the concerns is the highlight of the corruption, not just on the pharmaceutical side, but the lack of patient care was something that had been going on for years. It was highlighted in August. It percolated into September. It rolled into October. It was into November. People asking for additional resources that were strained at the very best. And yet we have 3 colonels who stepped up and said it just wasn't happening. And then we have multiple issues where evidence and documents and things were either destroyed or people were given instruction, at least they believe they were given instruction to reduce evidence. I'll ask you, General Caldwell, the Japanese government was generous enough to donate $11.6 million in fiscal year 2010 specifically to fund the Afghan medical system. They were considering donating another $23.8 million. There's a series of correspondence that we have where there's discussion at the senior levels of leadership within your command questioning whether or not we should share any of the concerns that we had with corruption, with abuse, with the stealing. My question to you, General, is did we share that information with the Japanese government, and what did they ultimately decide to do?
I would have to go back and review, Chairman, what they ultimately did. As I best recall at this point in time, they did provide the resources. But again, I think a big part of that is, we brought all the ambassadors in Afghanistan in, and as a minimum every quarter, if not every other month, and gave them a complete update on the development of the Afghan National Security Force. And during each of those briefings, we always laid out all of our challenges and the ongoing efforts that we had in working with the Afghans through certain very challenging issues. It always made for a very lively discussion with all the ambassadors because they, of course, had their own country's concerns of different things they were seeing or observing inside of Afghanistan. So I would dare say that the ambassador and I, because we had a fairly close relationship from Japan, would have had a good dialogue on that, although I can't produce an email to show you that. But he and I had met often enough and did get together because they were one of our key donors. And obviously one of the things that I took on very serious, my role as a NATO commander, but also wearing a dual-hatted American hat as the American commander, was to seek as much international contributions to reduce the amount of money that the United States was contributing to this effort and to get greater international participation. I mean, in the end there, we had 37 different nations that were contributing to the NATO training mission from what was originally 3 nations when I took command in 2009. So there was an enormous effort on our part to bring more and more of the international community into this, not only to seek to assist us at that time period, but more to look towards the future and a long-term commitment inside of Afghanistan, again, to try to help the overall reduction of what America would do, both in terms of not only monetary assets, but the presence of our men and women there, too.
General Patton, do you have anything to add to that?
No, sir.
General Caldwell, I just want to, again, I don't mean to belabor this point, but it's a very serious allegation. I want to give you a direct opportunity to respond to what a witness said before, where Colonel Fossil's quote about you, referring to your conversation, how could we think to invite the IG during an election cycle? He calls me Bill. Is that something you said?
Chairman, at no time during the course of making the decision to invite the DOD IG in or while they were there did I ever make that statement.
No parts of that statement, he calls me Bill, is that something you said or did not say?
Again, at no time during the time period we were preparing to call the DOD IG in or while they were there did I ever make that statement. There was a period in time earlier, several months before, when I, as part of a briefing that General Petraeus was given as an update by video teleconference to the White House, was invited in to give a portion of an update on the development of the Afghan National Security Forces. And when I was given that portion of my briefing to the President, I did come back and tell my staff, and I was actually very impressed by the fact that he was prepared well enough during the briefing when I had my part come on to have been able to refer to me as by my nickname instead of by my formal title. And I mean, I think anybody who has the President of the United States call them by their first name probably remembers that. And so I know, I'm sure I came back and talked to my staff and commented to them, because it was an impressive thing to have that done. But it had absolutely nothing, nor did I ever refer to it during the time period of the request of developing or preparing for the Department of Defense IG to come in and help us during this time period.
I appreciate your clarification. General Patton, did you ever witness that, or did you have anybody come to you with concerns about those comments?
In the 18 months I served beside General Caldwell, I never heard him make that statement or refer to anything other than an apolitical context.
Did anybody else come to you with those concerns that that statement or a version of that statement had been said at that time?
No, sir. And if I could just reiterate, I mean, I did not direct, nor did I receive orders from anybody during that time period to avoid, impede, delay the DOD-IG request for a visit.
Thank you. I'll recognize the gentleman from Massachusetts, and then we'll wrap up.
Thank you. I think we've heard enough here today, and I want to thank everybody for their testimony, for taking your time, and again for your service. Thank you.
Thank you. I appreciate working with Congressman Tierney. These things are not partisan issues. The idea of rooting out corruption, fraud, abuse is something I think that we're all dedicated to. Again, I want to thank the service of the men and women who have served in the most difficult of circumstances. I can't imagine being away from I have a hard time being away from my family for 3 days, let alone serving a year plus, and yet we have men and women who routinely do that in the most difficult and dangerous of situations. So I cannot thank you for your personal service, but the service of literally millions of people through the years who have stepped up and answered the call to protect this nation and provide for the interests of the United States of America. With that said, I do think the committee needs to continue to evaluate and make recommendations about how to improve the process of transparency and specifically oversight. In the fog of war and the difficulties of war, oversight is exceptionally difficult. And yet we find story after story, instance after instance of abuse, waste, fraud that has to be dealt with so we can improve it. That's the spirit in which we come here. These are precious resources. The critical mission has to be executed, but what is not acceptable is withholding of evidence and information. That will be further explored. As we wrap up here, I want to give you each, if you choose, you may choose not to, but I just want to make sure that for the record, if you have any other thing that you would like to share with this committee for the record, just kind of go down the line. We'll end with you, General Caldwell, maybe start with Ambassador Moorfield. If there's anything else you wish to speak to, I just want to give you an opportunity to do so, and then we'll conclude.
Thank you, Mr. Chairman. Actually, there is one point I'd like to make. We had an ongoing discussion with the command about their need for additional personnel resources, certain skill sets that they lacked to be able to provide appropriate care with respect to developing acquisition requirements and oversighting the execution of contracts in order to prevent fraud, waste, and abuse and corruption. And indeed, at one point, submitted a letter to the Department of Defense supporting a request that the command had previously made for those additional oversight resources. So I'd just like to make that one point.
Thank you. Again, thank you for your service. General Patton.
Yes, Mr. Chairman. Thanks for this. Just a final wrap-up comment. I'd just like to say I'd spent 18 months of my life at the NATO training mission in Afghanistan and consider my tour of duty there as one of my career's most challenging yet most fulfilling tours of duty and assignments, and most rewarding. I put my heart and soul into this job. I stand by everything I did in the performance of those duties and acknowledge clearly that the two toughest issues I dealt with during my time there as Deputy Commander were, one, the AWOL rates and attrition among the Afghan Army soldiers. We didn't talk about that today, but I think that's something that needs to, we need to maintain continued persistent effort on, working with our Afghan counterparts in order to build an enduring force there. And then secondly, the issues with the hospital. It was a complex issue, sometimes gut-wrenching, and due to all the things that I think were discussed here in this hearing today with regard to corruption, substandard medical care, bad leaders, apathetic doctors, and so forth. I want the committee to know that I took this problem very seriously during my time there, and were it not for the persistent efforts of the people at this table and others in NATO training mission Afghanistan, we would not have ever seen some of the positive changes that occurred during that time frame there, especially in the December, January, February through summer of 2011. Specifically, the change in Afghan leadership within the Office of the Surgeon General, General Yaftali, and other positive changes that I described earlier in responding to Congressman Tierney. And so I would just like to say that thank you for the opportunity today to make those points, to clarify some points on the record that had been presented previously to this committee that lack some of the greater context and lack some of the clarity that I think we've helped provide today. Thank you.
Thank you, General. General Caldwell.
Chairman, thank you again, and to the committee members for allowing us to have this opportunity to come here today to discuss these various issues. I will tell you those pictures you showed at the beginning, I just want to say one more time, are absolutely unacceptable. And there's nobody within that command that I had the privilege of serving with that once thought would have done anything less than what we did do there on November 10th once they became known to the command leadership, and that was decisive and immediate action with a thorough continuing effort and emphasis thereafter to ensure that that kind of thing did not occur again, because that's not something people tolerate. And I'm glad my command IG was able to bring it to our attention so that we were able to take decisive action internally within our organization to immediately address it and deal with it. I will say that we at all times during the 2 years that I served there worked very diligently to be good stewards of the taxpayers' money that you also have graciously been able to give to us to enable us to do that mission. In fact, by the end of the 2-year period that I had served there, through various programs, efforts, and efficiencies that we had put in place, it was just over $3 billion that we were returning that we did not need, that had already been previously asked for, that we found that we were not going to need to spend because of the efficiencies and effective things we had put in place. Not because we weren't still doing what we had planned, but we had done it in a far more efficient and a far more effective manner. We had redone contracts. We had gone back in and looked at how we procured things. I mean, the amount of things we did to greatly reduce the overall amount of expenditures that we had was really phenomenal, with just an incredible group of men and women dedicated to doing that and finding everything they could within their abilities. I do want to tell the DOD IG, he was correct, Ambassador Moorfield is, in that each time that we were able to bring them in and they identified that we had challenges, that we knew we did, and then we were able to take and follow through with a request for additional forces. It was that supporting document from the Department of Defense IG's office stating that we had challenges and we needed additional resources. It was a continual effort throughout the entire 2 years I was there. I'm not sure there's any one commander that wouldn't ever request more resources, but there were key critical assets we absolutely had to have at different points in time that were absolutely essential, and the Department of Defense IG's office helped to surface that. So it came up through multiple ways, because I did have complete trust that my leadership was providing me the resources that they had the ability, looking at the much bigger picture when I would ask for something else to assist the men and women in the command, American and NATO, and partners that were working with us to get after our mission. And I am incredibly grateful for the men and women that served over there, both military and civilian, international and United States, that during the 2 years that I had the privilege to be associated with them, were willing each and every day to get up and do the absolute very best that they could within the resources that they were given to make a difference inside of Afghanistan and try to help move that entire effort forward so that we all could move to the point where in December of 2014, we can, in fact, transition the lead for security to the Afghans and then only have minimal support being provided them from either NATO or U.S. assets thereafter. So thank you, Chairman.
I thank you all, and may God bless the United States of America.